He was a traditionally trained acupuncturist, so he worked mainly with TCM style acupuncture. And as you all know, although TCM is an amazing tool, when we're talking about treating pain, in most cases it's just not enough, unfortunately. From here, if I was in my office, especially in a situation where we have limited range of motion, I'd probably have started, and something that's been going on for so long, I've started with 7701 and 02. But I didn't have the right needles to go through the tendon. It wasn't really a situation where he could be comfortable in a position where I could reach these points, so I decided to go for a different approach. So all I did was search for Ashe points that were over the Dumai and a bit posterior to Do24, so around Do22, Do23. But the next morning, again, he saw me at breakfast, he came to my table and he told me, well, just to give you the feedback that no pain came back. I woke up today completely pain-free, and this was very rare because he was always worse after sleeping. So he was ecstatic about his improvement. Hi and welcome back to the channel. Today I'm bringing you an interesting case that happened during my holidays. So I've recently been on holidays, and it just happened that while I was at the hotel, we were at one of those kind of resort-like hotels, and I noticed that one of the guests that I've crossed paths with a few times during breakfast or dinner, and a lot of times I'd see him and he looked like he was in pain. You could see that there was something wrong, probably with his neck. He couldn't really turn his head. And some days I could really feel that he was in a lot of pain. So one of the days I decided to approach him. And well, I'm sure if you, while you're watching this, if you're an acupuncturist, I'm almost certain that you'll do the same thing that I do, which is I always travel with a few packs of needles, a few alcohol swabs, just for any emergency. So one of the days I decided to approach this gentleman. This was an older gentleman, around late 60s probably. And so one of the days I saw him sitting at one of the common spaces at the hotel. I approached him and I said, "Hey, how are you doing? I've been seeing you around the last few days and it looks like you're in a lot of pain. Maybe I can help because I'm an acupuncturist." And the biggest coincidence happened because he was actually also a French acupuncturist. So he lived in France, he worked with acupuncture. He told me, yeah, he's been suffering with neck pain for the last 2 to 3 weeks, and it was really bad. Some days he hardly could move, some days it was a little better, but he was always with pain. And I asked him, well, you're an acupuncturist, did you try to treat it? And he said, yes, but with no results. He was a traditionally trained acupuncturist, so he worked mainly with TCM style acupuncture. And as you all know, although TCM is an amazing tool, when we're talking about treating pain, in most cases it's just not enough, unfortunately. And that's exactly what happened to him. He tried a few local points, he tried a few ear points from the Chinese ear acupuncture system, but nothing worked. So I said, well, do you mind if I try something? I have a few needles on me. He said, well, I'm up for anything. And so I went to get a pack of needles and I decided to take the case. So the gentleman's case was, as I said, cervical pain, and it was mostly on his right side, going all the way from the base of the skull, shooting more or less to the area of gallbladder 21. Asked him to move the head to one side to the other, forwards and back. All the movements had pain, mostly on this side, but also on the midline over the Dumai. So my diagnosis was very clear. Affected channels, we had Dumai plus bladder plus gallbladder, all on the right side and all in the area of the neck. From here, if I was in my office, especially in a situation where we have limited range of motion, I probably have started, and something that's been going on for so long, I've started with 7701 and 02. But I didn't have the right needles to go through the tendon. It wasn't really a situation where he could be comfortable in a position where I could reach these points, so I decided to go for a different approach. And so I went for, as usual, a combination of balanced method and Master Tung. And the first thing I did was using Master Tung's 11.11. This is Fei Shin. As you can see here, Fei Shin has the Shenjing of the heart and the lungs, and it's a set of 2 points on the middle finger, and this point has the indication for cervical pain and also for headaches, especially on the back of the head and the base of the skull, which the patient also had from the long time he'd been dealing with neck pain. When needling 11.11, you can needle both points, but the more effective way, in my opinion, is to thread both points. And the image here is as if you were threading a needle all the way through the spine, in this case the cervical spine. And this was used opposite side, so on the left. This point is very good to treat pain that's over the dumai, but also very good to treat a more lateral pain, especially related to gallbladder, because although this is not the exact finger of the triple warmer, it's very close to the area of the triple warmer, so it has a good action over the gallbladder, because triple warmer balances gallbladder according to the balance method. I asked the gentleman to try a few movements, and he told me that the pain was going down. So I kept going, and I added another set of Master Tung points that is classic for neck problems and cervical pain, which is 22.01 plus 22.02. As you can see here, these points are on the palm of the hand, and they are very close to the lung channel. 2201 has the Shenjing of the lung, 2202 has the Shenjing of the lung plus heart, and they have the classical indication of cervical pain. Plus, being on the lung channel, classical lung channel, we know that the lung channel balances the bladder according to the balance method. So this was another great option for a problem, so I added these points on the same side, so on the right. Because the connection between bladder and lung, which is Tai Yin, Tai Yang, is a system 2 connection, so it can also be used on the same side. So I decided to apply these points same side. I asked the patient to move, and again the patient said that the pain on the lateral side of the neck was a lot better, but the pain over the midline was almost the same. So here I decided to start tackling more of the dumai. And the first thing I did was, again, going opposite side and using small intestine 3. This is a point that has the classical indication for neck pain, plus it's a point that we know opens the dumai. So I used it on the left side. Again, small intestine balances bladder on the opposite side. And the patient told me that the pain over the dumai was improving, but there was still some pain when he was moving his head up and down. So I decided to use the scalp system of the balance method. And what I did here is you go over the line of the dumai on the scalp, and the head will start more or less on the hairline, so more or less around 24. You know that head starts, and you go down the spine as you go along the dumai, going towards 220. So all I did was search for ashi points that were over the dumai and a bit posterior to 24, so around 22, 23, and I found a very painful point over the scalp, so I used it around. So as you move from anterior to posterior, starting on 24, you will be moving as if you're going down the spine, so going from the head all the way down to the neck. So I kept palpating, and I found an ashi point. Sorry for the ambulance. I found an ashi point more or less in the area of do 23. And so I needled that point, and I needled it, threading it through the dumai from front to back, as if I was sliding a needle all the way through his spine, going all the way down the neck. I asked him again to test it, and he told me that the pain was a lot better again. There was still pain, it was still bothering him, but it was much better. This threading technique is very close to what I told you I was using for 11.11 for Fei Shin, and it's exactly the same reasoning. After doing this, the gentleman told me that all the pain had gone down. It hadn't gone away, but he could move much more freely, and the pain was way down, so I decided to stop here. Again, we were at a common area of the hotel. I didn't want to have him full of needles. I didn't want to put needles in his legs in case we had to move. So I just stopped here, and right now he had 5 needles on. The patient was reporting improvement, so I decided to stop there. And we stayed there talking a little bit. He told me about his practice, and we gave it more or less half an hour for the needles to work. I took the needles out, and we said, well, when we cross paths again, we'll see how you improved and see if we can do anything else. He thanked me, and we went on our separate ways. I went to the pool, and I kind of forgot about the case until when we were at dinner, the gentleman comes to the table I was sitting at with my wife, and he tells me, well, about an hour after the treatment, all the pain went down, so now I'm completely pain-free. And he was very happy. I was also very happy. And he went on to get his dinner, and I didn't see him for the rest of that night. But the next morning, again, he saw me at breakfast. He came to my table, and he told me, well, just to give you the feedback that no pain came back. I woke up today completely pain-free, and this was very rare because he was always worse after sleeping. So he was ecstatic about his improvement. And we got to talk a little bit, and he was very curious. He was asking about what technique was this. He'd never heard about Tung acupuncture. He'd heard about the balance method, but well, he thought it was more for just very simple cases of pain. He wasn't very sure about how it worked. So we talked a little bit about distal acupuncture. He was very interested. I gave him my YouTube channel, obviously, and he said, well, if you're ever doing a course in France, he will come to my course, because he was really impressed. And again, this is one of the reasons why I can be so annoying while trying to spread the gospel of distal acupuncture and spread the message and advising any and all acupuncturists to go learn distal styles of acupuncture, especially Tung and balanced method, because this method works. Again, here we're talking about a very experienced acupuncturist who tried to treat himself and couldn't, and he was dealing with a problem for 3 weeks with full treatments, with MOX, with local needling. Nothing worked. And with distal needling, with 5 needles in a hotel lobby where I couldn't use most of my number one tools for situations like that. So I didn't have my ontakif to do the myofascial release of the neck with moxa. I couldn't do bloodletting. I didn't want to do needles on his legs. So even with one of my hands tied behind my back, I could help him in a way that classical acupuncture had tried and failed. And this is why I think these techniques are so amazing. It's not that I'm an amazing acupuncturist, it's that the techniques are so good that anyone can get this kind of results if they work with distal acupuncture techniques. And that's why I work so hard to spread the message, being through this channel, being through the conferences I go to, being through the courses I teach around Europe. It's very important that you start to learn these techniques. I'm sure there are other techniques that are in the same range of efficacy, but to be honest, especially when we're talking about pain, I've never seen any technique that comes close to Tung plus balance method. And even for internal medicine, it's hard to find competition. So if you can find a way to properly learn these techniques, please go for it, because this can really change your practice. And this was it. Thank you for watching. If you liked the video, don't forget to like and subscribe to this channel and share this video with anyone that might benefit from it, and I'll see you in the next one.